to share kind of the couple big myths. Hey everyone, Jessianna Saville here from the Kidney RD. I'm going to talk about 3 myths about diabetes and chronic kidney disease today that I really want to resolve and help people get a good understanding of what they really need to do here. If you don't know me, my name is Jessianna Saville. I am a registered dietitian and a renal nutrition expert. And I come in here frequently to just clear up a lot of big myths about chronic kidney disease and hopefully simplify the diet and give some direction for people so they don't feel like they're on a slippery slope to dialysis. Now, diabetes and kidney disease is a really confusing topic for a lot of people, and a lot of people are not sure which list to follow, more or less, is what it comes down to. They don't know which one they should follow, the diabetes list, the kidney disease list. They want to be able to be healthy, but they're not sure how to balance all those pieces. And so that's what I want to talk with you about today. Now, let me just pull up my notes here. When this went live, I lost my notes. Here it is. Okay. I want to make sure I don't forget anything. So the first thing that we want to talk about today, and again, I'm doing 4 different posts on this week to go through a lot of these pieces. Now, one of the big myths that is out there is that a plant-based diet is too high in carbohydrates, and so it's going to increase my blood sugars. Now, for the most part, this is false. What is true is that a lazy plant-based diet or very processed vegan diet is not going to be helpful for diabetes or kidney disease. Just cutting out meat is not the answer. What is the answer is getting a nutrient dense, meaning you have kind of a variety of different, colorful fruits and vegetables, some nuts, some good healthy fats, so that you have a variety of foods that is well balanced, and that can be effective for both diabetes and kidney disease. Now, I did mention yesterday, if you tuned in yesterday, that some people's diabetes, especially if they're very fragile, they don't always do really great on a plant-based diet. And in that case, sometimes we know that we need to improve their insulin sensitivity, and we do that with one of our custom ketogenic approaches. That's not for every single person. A lot of times the simplicity of a plant-based diet, if you just learn how to get enough fat in there, get the right proteins in there, can work really good for a lot of people, both at preserving their kidney function and at controlling their diabetes. One thing you have to remember about diabetes and kidney disease is that they both have some underlying inflammation to them. So when it comes to diet, we really want to reduce inflammation. One of the best ways to do that, and I know this sounds cliche, but one of the best ways to do that is to increase the amount of non-starchy vegetables in your diet, in particular for both CKD and diabetes. So that can be, like a salad, broccoli, cauliflower, green beans, a lot of vegetables like that. All right, the second myth. Now, this myth that has been perpetuated in the management of diabetes for years and years, I feel like really hurts people that have diabetes and kidney disease. And this is the myth, is that you need an animal protein at every single meal. Think egg, chicken, fish, beef. You need some sort of an animal protein at every meal. Otherwise, your blood sugars are going to shoot up, and there's no way to control them. That is false, right? Protein is not the only nutrient that controls blood sugar. Now, for some people, it can be, you definitely need some protein with your meals, but it doesn't have to be an animal protein. Sometimes what is a more effective strategy that works for diabetes and kidney disease is to get a good source of fat at every meal. Think like a nut butter, like some peanut butter, or a little bit of avocado. I know some people are like, I can't have avocado, too much potassium. You probably can fit some avocado in. It's not totally off the table for every single person with kidney disease. A lot of people have a little bit of wiggle room to fit it in, and it's a great source of healthy fat. Maybe it means that you're doing some extra virgin olive oil on your salad, or maybe you're mixing it in with, some of your other dishes so you have a good source of fat. that source of healthy fat with your meals can really help stabilize your blood sugar. The other piece of this, and sorry, I'm pausing there for a second. The other piece of that, and the reason why it gets confusing, is that you hear like, hey, like I need to have this low protein diet, but I gotta have protein at every meal. And again, you don't have to have an animal protein at every meal as long as you are considering fat in your meals. And that is what we do with our clients that we're balancing diabetes and kidney disease. We want to get some good healthy fats built into their diet throughout the day. So if you have diabetes and kidney disease, maybe don't think about protein quite as much as think about some good healthy fats. Some nuts, some avocado oil, olive oil can work really good. Some people use a little bit of ghee, some people use a bit of coconut oil, but balancing out those fats can be really helpful. All right. The third myth that I want to clear up is that I can't fast or follow a ketogenic diet if I have diabetes. I can't fast because it's too long without calories. Can't follow a ketogenic diet because it's too low in carbohydrates, and I will get hypoglycemic. My blood sugar will plummet if I do either of those approaches. Now, this is also false. Now, I'm saying this is false, but also with a warning behind it, because there can be some risk if you just wing it of doing either fasting or a ketogenic diet without some management, and definitely without discussion with your doctor about how that's going to impact your blood sugar with the particular medications that you're on. Now, fasting and ketogenic diets can improve your insulin sensitivity, which means you're going to utilize your carbohydrates better and bring your blood sugars down. So it can be a helpful tool, right? It can definitely be a helpful tool for controlling diabetes and kidney disease. If you want to implement a fasting approach where you're doing maybe 12, 14, 16 hours without food, or if you're doing a ketogenic diet, then you really need to talk with your doctor who's managing your diabetic medications to see how they might need to be changed or adjusted. So some medications like insulin, glyburide, glipizide, glimepiride, they can cause hypoglycemia with intermittent fasting or a ketogenic diet. So you really need to have a good discussion with your doctor. One of the things that our dietitians do is that when someone comes in and we are maybe working towards this type of approach, is we talk with the physician and ask if we need to be adjusting any of those medications or watching them so that people don't get a really low blood sugar and feel absolutely terrible. That is why if you have diabetes and kidney disease and you're thinking about, the new year, people are like, I'm going to lose weight, going to get healthier, they're going to do a ketogenic diet. If you're on that pathway, then please talk with your doctor and work with a skilled practitioner so that you can safely implement either of those protocols, which can be great for kidney disease or diabetes. Okay, so as a recap, a plant-based diet is too high in carbohydrates, so it's going to make my blood sugars go up. False. A lazy plant-based diet or plant-based diet with not enough emphasis on healthy fat, yes, that could be problematic. So you really need to focus on the healthy fats in your diet. You have to have animal protein at every meal. That's also false. You don't have to have animal protein at every single meal to keep your blood sugar stable. An old myth that has been perpetuated in the diabetic community for many, 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 many years. For some people that is helpful, but if you have kidney disease, it is not. I would focus on getting some fat in your meals instead. Number 3, I can't fast or follow a ketogenic diet if I have diabetes or kidney disease. And again, that is false. But if you are thinking about a ketogenic diet or a fasting approach, you're going to really want to work with a professional so that you can safely implement those without having your blood sugar drop, and also so that you don't get too heavy on the protein and end up causing problems with your kidneys either. That's it for today. If you have questions or things that you're confused about with diabetes or kidney disease, please drop them in the comments below so we can see them and then I can address them later in the week. If you found this is helpful or can answer some questions of people in another forum or group, please share it with them as well. We love to be able to get good information out to people and start just moving that confusion away so that people can make progress and preserve their kidney function for their life. Anyways, that's all for now. We'll talk to you later. Bye-bye.